Everyone. I know the pre-lunch sessions are a little tough. Everyone has full their scientific minds now on the come, their most important part. So lunch is always tempting and it's difficult to hold on the stage at this point. So I'm Dr. Vishal Rampuri. I'm a plastic and a cosmetic surgeon. And being a plastic surgeon in a room full of gynecologists, I can only talk about collaborations and I restrict myself to the gynecological part only. Uh, when I talk about the collaborations, what I feel we are sitting on crossroads. Crossroads what literally means it's a critical juncture where we have to make some crucial decisions which will have a far-reaching consequences. So there is a recent growing demand of improving the aesthetics of genitalia among both female and male patients. And that growing demand made doctors look into that direction. So now we're seeing more such conferences, learning opportunities coming up where everybody is interested now in learning gynecology, cosmetic gynecology. So apart from surgical treatment, there are a lot to offer. As my previous speakers have mentioned, there are a lot of energy-based devices, chairs, PRP therapies, and a lot many more. Uh, Fillers, threads. So when we are moving forward, we should always look behind us, what history has in store for us. So desire is ancient, but the science is modern. You can find references of clitoral surgery as long as performed as long as in first and second century. Labioplasty is in 7th century. Vaginoplasty being done in 11th century. But the recent cosmetic genital surgery for purely aesthetic reasons was first published in medical literature in late 1970s and early 1980s, and has since grown rapidly into a recognized field of aesthetic and functional surgery, so much so that it's most sought after surgery after breast and face. And in few Europeans and especially Americans society, it has grown many folds. So why there is a boom today? Of course, there is unrestricted availability of pornographic material, retouched media, exposure to digitally altered intimate images online. There are more open discussion nowadays about the intimate appearance, and there's growing self-awareness about their personal anatomy. So, although we are excising skin and rearranging the tissues, but in reality, it's all about improving their self-image, giving them their sexual confidence, sometimes treating some deep emotional trauma, and relieving them of their deep personal insecurities. So in cosmetic gynecology, the scalpel touches the body, but the outcome remains in the mind. So procedures now offered, of course, we are doing it from quite some time. Plastic surgeons usually started these procedures. Now gynecologists have come into it, and due to the gray zone of regularities, some cosmetic physicians and aesthetic clinics are also offering these procedures, which are not, authorized. So treatment offered without training carries a huge risk. The surgeries have potential complications like infection, pain, scarring, adhesions, altered sensation, dyspareunia. So why training matters? So tissue handling requires a lot of precision, and you should have a thorough understanding of the aesthetics and the symmetry. Of course, when you do a surgery, there is a scar, and you should be aware about its impact on the future life, and about what you will do with the scar management. And of course, you should have a skill set for revision surgery and competent enough to manage complications of your own, and of course, so much growing, the field is so much growing to manage complications of others also. So what I offer is more surgical treatments because I feel I can give results which are more sustainable, which are more predictable, and which are more long lasting. In my practice, The patients coming up for merely for labioplasties, vaginal rejuvenations, and of course hymenoplasties. And we do, of course, being called upon for reconstructive surgeries also. Due to growing social media awareness, marketing awareness, patients do come for non-surgical treatments like O shots, P shots, and other laser treatments also. So plastic surgeons are not only trained to perform the primary procedures, but also handling the complications. Few years back, when there was no much awareness about these procedures and not many gynecologists were offering them, a patient, young female came to me for her enlarged labia minoras, and she visited multiple gynecologists, but always dismissed, being termed as a normal anatomy and nothing to worry about. Her real issues were functional discomfort, aesthetic distress, and psychological inhibitions. So I performed a labioplasty. The problem was not just being the labia, it was being unheard of. And as my previous speaker mentioned, why you are performing a surgery is very important. Why the patient is demanding a surgery is very important. You have to understand it and then offer whatever you have to offer. So there is a lot of ethical considerations you should keep in your mind in dealing with, especially in female genital cosmetic surgical field or non-surgical field. It is essential to maintain a balance between different perspectives. The surgical fraternity must not pathologize normal genital diversity. Patients should not be led to believe that a specific genital appearance defined well-being. The female body is degenerative or you require a surgical improvement. We should not feed them in their mind. You just hear them out why they are looking for improvement and what you can offer. So recent ACOG recommendations and conclusions which they recommend is patient must be clearly informed before undergoing procedures which are aimed at altering their sexual appearance or function. So cosmetic procedures should be distinguished from those performed for clinical indications because they have a long-lasting effect. You're not doing a particular procedure for getting them rid of any disease. This as a previous speaker mentioned, it's kind of a pleasure surgery, more of a pleasure surgery. So ethical practice requires transparency, it requires evidence-based counseling and respect for natural anatomical diversity. Whenever a client walks into my office and he specifically demands a procedure, I always hear them out, why they want it. I offer them everything what I have, the surgical, non-surgical things, and let them go back and decide upon it. Sit on the counseling and then come back and then we proceed further. I never jump into it because this stays with the life and especially in their mind. So again, as I said, we are here at the crossroads. So we all are looking for better outcomes. We all want our practices to grow ethically. And we always want a stronger patient base which remains with us through our lifetimes and their lifetimes. So how can we help each other? Gynecologists can identify suitable patients, address their medical aspect and build initial trust. And of course, as a plastic surgeons, we can deliver it. And of course, manage the complications as and when required and arises. So when specialties collaborate, patients don't choose doctors, they choose confidence. And that we should be aiming for. We all think the patient is coming for a consultation. Today in a time of social media awareness, everything is on internet. So believe me, they are coming with a mindset. They are more informed than ever before. Information is literally at their fingertips. Tools like ChatGPT, they research not only the procedure, but also the surgeon's credentials and reputation before walking into the clinic. I have patients asking the ChatGPT about my Google reviews, about my credibilities, and ChatGPT gave them the answers, then they walked into my office to get the treatment done. So whenever you think you're advising them that treatment, no. They're looking what they already have in their mind. So you have to be very judicious and cautious what you're advising to them. So this is my center, Siyasha Center for Advanced Cosmetic Surgery. I have an operating facility and non-surgical treatment options are available. You should have this kind of facility which is exclusive. where patient feel her privacy is taken care of. You can offer complete range, and you don't mix them with the normal patients which have come for this, other treatments, for a medical treatment or other gynecological surgical treatments. So they feel more safe and connected. And of course, I get patients from all over the country. There's some before afters. I do many other procedures, body sculpting, breast augmentations, rhinoplasty. I'm just focused on gynecology today at my talk. And with that, I would like to thank IMSCON organizing committee for giving me the opportunity to share my thoughts upon it. And best wishes for the wonderful conference ahead. I feel these kind of knowledge sharing conferences is a need of the hour, where we can collaborate, we can exchange ideas. I can learn many things from you, and I can share a few tips of mine own. Thank you so much.
Thank you,
Thank you,
Dr.
sir.
Vishal, for such a beautiful talk. Thank you.